For more on Walter Reed and its legacy, I'm joined by Dr. Howard Markle, Director of the Center for the History of Medicine at the University of Michigan. Dr. Markle, many of us know Walter Reed as the first stop at home for wounded soldiers. Tell us a little bit about the care it's provided over the years.
Well, it's provided first-rate care for almost every disease and problem under the sun. It is, as you said, a general hospital, so that meant it always had a first-rate surgical department, pathology department, internal medicine. It even had an excellent pediatrics ward. So the care there was as good as the care delivered anywhere in the world during its 96-year history.
What kind of advances in rehabilitation have come out of Walter Reed?
Well, as you noted, this is where soldiers who are wounded in the battlefield went, and the most seriously injured soldiers often went to Walter Reed. So rehabilitation medicine really took its birthplace at places like Walter Reed. For example, the amputation of limbs, which is not something you want to think about unless it happens to you or unless you treat it, but it's not just a mundane removal of a limb. The surgical procedure has to be done precisely right. You need to be able to fit a prosthetic limb over that amputated leg, for example. And you also have to be able to come up with therapies and treatments to teach soldiers who are injured in the battlefield how to walk again or use other limbs that were disabled. And don't forget, this is translated not just for soldiers who have been wounded in the battlefield. There are a lot of people, civilians, who have benefited from these rehab therapies that were developed at Walter Reed.
Now, we mentioned in our setup that it is, of course, known as a hospital for presidents, notably President Eisenhower. Tell us a little bit more about that.
Well, it was indeed President Eisenhower's hospital. Ike, as a confirmed Army man, it's not surprising that when he became Commander-in-Chief, he chose Walter Reed as his primary care site. He did have a very serious heart attack, as you mentioned, in 1956, far more serious in retrospect than it was reported at the time. He also had a small stroke and a bowel obstruction during his presidency, so Walter Reed was in the news quite a bit back then. And of course, Eisenhower finally died at Walter Reed in a specially designed suite, which is now still preserved in his honor.
A lot of famous other folks have been there, presidents and a lot of military figures. I was reading about General John Pershing, for example, spent his last years there.
Absolutely. Blackjack Pershing, who led the American Expeditionary Forces in World War I, had, as it was called in those days, a weak ticker. He had a bad heart. He had several heart attacks, and he spent his last 8 years of life in Walter Reed from 1941 to 1948. Right after Pearl Harbor, John Pershing wrote FDR a letter from his hospital suite begging to be recommissioned and sent to fight the Japanese. And of course, FDR sent them a very touching and kind thank you note, but no thank you note.
What about Walter Reed, the man? We mentioned him in our setup, but he sounds like quite a remarkable figure in his own right.
He was indeed. He was a true medical hero. As you mentioned, in 1900, Walter Reed and his colleagues figured out the transmission of yellow fever, which was a very common, contagious, mysterious, and I might add, disgusting disease. It was very common in the southern United States, as well as Cuba, where Walter Reed was stationed, and South America. And the idea that a mosquito could be the intermediary between a germ, or a virus in this case, and a terrible disease was a hard sell to make. But Walter Reed and his colleagues proved unequivocally and scientifically that that was the case. And they revolutionized medicine because it wasn't just important in that part of the world, Cuba, but you could have never have built the Panama Canal, which was started just a few years later, if we had not figured out the importance of controlling mosquitoes from breeding and also from using mosquito netting to prevent being bitten by these disease mosquitoes.
Dr. Markle, I know you've known a lot of the doctors who've been there. Is there a culture that goes along with the name Walter Reed or these kinds of top military medical facilities?
Absolutely, and it's not all that dissimilar what you used to see in many hospitals, military or civilian, 20, 30, 40 years ago before the medical marketplace took over. But the Walter Reed culture, and I interviewed quite a few doctors and nurses and people who had worked there when I started writing about Walter Reed Hospital. And 201, they all talked about the culture of service. the traditions of how they trained their doctors and nurses, how they took care of patients, the sense of family and heritage that I think is very difficult for many of us who are civilians to understand.
So we're talking about how important this hospital has been and still is, and yet we're talking on a day when they're talking about shutting it down. So you're a historian. What fill in that disconnect for us? What happens to hospitals, even great ones like Walter Reed?
Yeah, it is a sad day. It's a place where, for example, General Patton went to see Black Jack Pershing for his blessing before he went off to World War II, where great medical advances were made, but it also reflects one of the great paradoxes of all hospitals in the 20th and 21st centuries. You know, doctors like to say hospitals are obsolete about 2 weeks before they open.
2 weeks.
And that's true of every hospital, even if it's an iconic hospital like Walter Reed. And these buildings are old and out of date, and a new hospital will replace it, and I'm glad to say that it will still be called Walter Reed.
Does the culture continue on, even though the building and some of the work goes on somewhere else?
Well, we can hope so. Hospitals are very special places. They're places where dramas unfold daily. They're places of tragedy and triumph, and where people work and give their energies to them. The new hospital would be a combination of both the Naval Medical Corps and the Army Medical Corps, but I have faith in the tradition of the Walter Reed Military Hospital that it will continue to do great things in the 21st century in its new incarnation.
All right, Dr. Howard Markel, thank you very